This is Unit 2 on therapeutic communication. We are going to review chapters 8 and 9, and then in Potter and Perry, chapters 11 and 12. So, the question for today's lecture is, can I be a good nurse and not be a good communicator? Right, so, I want you to think about that as we go through each step. And if you already recognize that you are not a good communicator, some of these tools that we're going to go through that you could utilize, practice, and put into place to make sure that you can improve those communication skills. Because if you just use that base of, I'm just not a good communicator, are you going to be successful? All right, so we're going to look at the basic elements of communication. So we know when we communicate, sometimes you may feel like you're talking to a wall, but we should have somebody that is receiving that message, right? Whatever you're trying to say. So we have some terminology that we're going to use to better understand that. So our sender, let's say, is you, the one that is trying to get the message across. You are sending a message, whatever the information is, the idea, the thought, the concern, the anger, the frustration is going to be that message that is going to somebody. And then that something or somebody is going to be the receiver. So that receiver is taking that message from the sender and then giving a response back, right? So if I ask a student a question, I am the sender, the student is the receiver, the question is the message, and then the feedback is going to be the response. So the answer to my question, right? So that's how that all is going to go. The channel is going to be, how did I go about doing this? I asked a verbal question. I looked at you and I said, excuse me, do you know the answer to this question? And you responded back. All right, so these messages could be verbal, just simple as that. However, could we do this all without any words being passed back and forth? So can we do nonverbal communication? And can that be the message that's sent? I can tell you, I definitely send my children a lot of messages nonverbally that get that point across very clear. Okay, and the channel would be a nonverbal facial expression or a hand gesture or the way that your body's positioned. So any of that could be the how that message is being sent across. All right. So we are definitely going to get into a little bit further in the nonverbal communication. But if you look at the terminology here, so verbal, vocal, and nonverbal. So verbal is going to be the communication, right? The words that I express out of my mouth, and those are going to be how you're communicating. Vocal is going to be how you say the words that you're saying. Okay, so if I take away nonverbal completely, which is really, really hard to do, but I just change the tone in which I'm saying something, does that impact your perception of the message? Right? So if I just say, wake up, I say, wake up, I say, wake up, right? So the way that you ask that is going to really affect the way that somebody's going to perceive that message. And then do you think that's going to affect the response or that feedback that you get regarding the vocal, how you speak, how you communicate those words? Okay? So thinking about that and thinking about the elements of each of those is really important when you're talking with your patients, right? Do you think your previous engagement in the room before that may be really chaotic and just not a good environment is going to impact your ability to reset yourself when you go into the next room, right? So if I just had a really frustrating patient on the other behind the door, and then I come into this next room, could I carry over some of that frustration? Or I just had a bad conversation with a coworker, or my boss just reprimanded me about something, right? So recognizing your way you're communicating is very, very important. All right, so nonverbal communication. So 80% of what is perceived is nonverbal communication. Right? 80% of what we use to communicate is nonverbal communication. So our facial expressions, our vocal cues, our posture, our gait, our movements, our gesture, eye contact, and territorial and space. So that meaning how close I get to somebody, how far away. If I just walk into a patient's room and I stand at the door, not only do I stand at the door, I lean up against the door and say something to them, or I just poke my head in through the door and say something. If I get very, very close, I sit down in a chair and I get right up close to their nose and start talking to them. So it's not saying that one is right, one is wrong, one is incorrect. It's the way that we adjust them to better communicate with our patients. And some of these things may be, personality traits that you have that you may need to tweak a little bit to better communicate with your patients. Because some things can be considered pretty standoffish or can irritate some patients. You think culture plays a huge role in a lot of these, right? So eye contact, different gesture, mannerisms. A lot of this can be a cultural thing that we are not recognizing, that we could be having somebody be offended by something that we're doing that we think is normal, right? Or you think is normal and they think is rude or abrasive, right? So paying attention to those cultural educational things that we talk about in class, and especially when you do your paper, right? Talking about those nonverbal communication would be super helpful in recognizing the differences. So let's talk a little bit about communication versus therapeutic communication. All right, so we use interactive, purposeful communication skills so that we can get a certain amount of things from our patient, right? So we can elicit and attend to our patients, get their thoughts, their feelings, their concerns, and their needs, express empathy and concern for those needs, obtain information to give feedback about a patient, and intervene and promote functional behavior, effective interpersonal relationships. And then finally, to evaluate the patient's progress. ADPI is something we will talk about in the next few lectures. But how are we, not only are we communicating with our patients, are we getting anything out of that information, those responses, that feedback from our patient to better care for them, right? That's our overall goal, is to be it's therapeutic, meaning we want to obtain something from that to allowing our patient to better improve. So things that I say to my patient should help improve their state rather than cause have more questions, more fears, and anxiety, right? So how can we elicit our patient to express their thoughts, concerns, and feelings, and then give them a little bit of reassurance or understanding or how to approach those worries, okay? How we express empathy and concern for their needs and show them that they're okay that they're in these situations. So some therapeutic communication techniques are going to be this concept of empathy. We're going to get into that a little bit further, right? What is empathy and how can we express it? Becoming an active listener. So solar, we're going to touch on that in the next slide. So that's going to be all about how we sit and how can we be an active listener with our patient? So think quickly before we move on about what you think that would mean. What does an active listener look like? So sharing observations. So things that you see the patient doing well, right? Seeing things that you have noticed that the patient's improved or that they're doing something a little bit differently or something that, is a little off that you're recognizing is a little different from their norm and maybe they want to talk about it with you. Using silence. Silence is an amazing thing that we sometimes totally forget is all our patients need. So if you are just constantly asking and asking and asking questions and not leaving that time for them to think and to kind of open up, think of a situation where you really wanted to say something to somebody, but you just couldn't find the right time. They just wouldn't stop for a second and give you, if they stopped for, an extra 10 seconds alone, right, could give you that opportunity to say something that you just didn't have the strength to do because you never really had the time to just, it didn't fit in anywhere, right? So if you use that silence, you use those open-ended questions to kind of let them talk and let them respond back to you. Clarifying is key in helping us understand the communication that they're giving us so that we can then help them. And also to get more information out of it. So if a patient says, I'm just feeling really upset, you want to clarify that today you're feeling more upset than you normally are feeling. And you're kind of bringing them more to, is it more upset than normal? Is there something more about that? So then when you bring that clarification, they then may add more to it for you. Paraphrasing things that they've said and summarizing. Self-disclosure also can give a good back and forth with your patient. Instilling hope and reflecting, right? So reflecting back on what you have done and what they have accomplished so far. Reflecting back on your conversation that you've had. So after you have this great positive conversation, you want to talk back to your patient and say, all right, this is what we've talked about. I'm going to check back with you about this, in an hour or next week or next, whatever time, next shift that you're going to be there. Make sure that there's some reflecting back on that conversation and what they can take from it. So SOLAR is another first one of these little acronyms that you're going to see a lot of in nursing school. So what this is talking about is how can you be an active listener? How do I know that you are actively listening to me when I'm having a conversation with you in clinical, in my office, here in class, right? So that I know that you're listening. So sit facing the patient. So that's where your S is that sit facing. O is observe an open posture. We'll practice a lot of this is how is your posture open? Right? When your arms are crossed, you are not open. When your legs are crossed, you're not open. When you are sitting behind a desk with your body turned to the side, you're not open. When you have your hands on a computer twisted, looking at your desk, you are not open to your patient. Lean toward the patient. So this is going to be your L, right? So you're leaning toward them, showing that you're interested in just them and nothing else. E, establish and maintain eye contact. Eye contact is huge, that you're actually paying attention to your patient. Again, think about cultural considerations with all of these, but eye contact is important. And R is relax. So if you're very stiff and rigid, your patient may not think that you have time or really care what they have to say, and you're just kind of going through the motions to get there through them. So make sure you are acting relaxed. Think of the times that your doctors walked into the room, sat down, put their computer down, and just looked at you, right? Leaned in, made eye contact, and just asked you what was going on. Okay, so remember this SOLAR, remember this active listener. I can tell you I use it with my 4-year-old, these different mannerisms to show that we're paying attention and that we're listening, okay? So communication and relationships. We've got this little cycle here, the elements of professionalism. So how can we be our best and our most professional throughout our communication, right? How can we employ these self-assessments in our communication skills? How are we making sure that we are doing this correctly? So this little cycle is super helpful it's got our color coded here, right? So making sure that we are being ethical. So responsible pro work to avoid ethical lapses and weigh their options carefully when facing ethical dilemmas. So that we are consciously aware of those ethical debates. Be the best. Strive for excellence and excelling at every level. Be dependable. Make sure that you are someone that people can count on. A team player. Be respectful. And be positive. So we not only have communications with our patient, our communication with our coworkers and our bosses is going to be really, really important. Especially in nursing school, your communication with me, your instructors, and your clinical associates is going to be really imperative to make sure that you're successful. We're telling you to be an active learner, an active participant, an active listener, all these things, and making sure that it's a positive communication so that we are being our best and our most professional with every interaction that we have. So empathy, you've heard this word empathy already a good amount throughout this little recording here. So empathy is the ability to understand and accept another person's perspective. So that understanding and accept is important, right? So the difference between our empathy versus our sympathy, right, reflects an understanding of what your patient communicated and that you both heard the feelings and factual content of the communication. You're non judgmental, you're neutral, and you foster respect. So you understand what your patient has told you. Doesn't have any feeling with this, right? You feel empathy, right? But you're not sympathetic to their thoughts or to their concerns. You're not making judgment, right? So it's just that I understand that this is hard for you. I understand what you're telling me, that you're having a hard time. Empathy is really, really helpful when working with patients that are really agitated, right? So if I have a patient that's super agitated with another nurse, right? So I come on second shift, and the day shift nurse, this patient could not stand. Said she does this, she does that, she does this. I am not going to say, you're right, I can't stand her either. She never cleans up the cart for me. It's always messy when I come on after her. There's always so many things I need to do. Clearly, you're not going to say that. But what you can say to your patient is, I understand that you're frustrated with this, and that the previous nurse did, right? So you can understand that. And you respect their concern, you respect their frustration, and then you're going to work on fixing those things, right? So you're not doing anything more than just recognizing that their thoughts, concerns, anger, fears are real and are factual to them, and that you understand that. Okay, so that's how empathy works. So some of these blocks to communication that can occur with working with a patient, and is also our coworkers, are going to be this false reassurance. I can tell you NCLEX and test questions love these false reassurance options, the kind of distractors. So we don't ever want to say, oh, you're going to be okay, right? We wish we could say that to all our patients. We don't know that, right? We don't want to give false reassurance that everything's going to be okay, that everything's going to be perfect. Don't worry about it. You'll be fine. We don't know that, right? So we can't give that false reassurance. Asking personal questions. So the second you start asking personal questions, and it's something that a patient does not want to answer, they're instantly going to put that wall up and no longer answer even your basic questions, because you've kind of breached that wall, that barrier that said, hey, that's going too far. That's probing kind of falls under there as well, right? You're kind of asking the same question over and over again. You're really trying to get to the answer. They're going to start to think that you don't believe what they've already said to you, right? So getting, over zealous on something like that. Stereotyped responses. So if a patient is going to ask you something and you're just kind of giving that blanket generic statement back, they're not going to give you any more, right? Belittling. Clearly, I'm not going to keep communicating with you if you're going to try to make me feel small or insignificant in the conversation. Giving advice, all right? So giving advice is a hard one for nurses. I feel like many nurses try to give advice, but there's a different way of going about this. We're not giving advice if we're actually educating, right? So there's a difference between educating and giving advice. And we need to make sure that we're educating efficiently. But we don't want to be saying, oh, well, this is what I did, or this is what my Aunt Sue does. So those kind of giving advice is going to really impede our ability to communicate with our patients. Blaming somebody. So there was a mistake, right? So the nurse before made all these errors, or your patient didn't like the nurse before. You come on, and instead of saying, I understand that you're upset, I know that I hear what has happened with that nurse prior to. Let's move forward, and I can do this, this, and this. Instead, I went and said, yep, that nurse is terrible. It was all her fault, or I'm running late because that nurse left me behind. They're not going to want to keep communicating with you because they're going to get that same response every single time. All right? So looking at types of questions, and we need to realize what is our goal when we ask a question, What are we trying to get out of it, right? If we just need a close-ended, specific yes or no, you need that specific answer, that's what we need, right? And usually we need these when there's quick responses. Um, did you take ibuprofen today? Did you take a narcotic today? Yes or no? We need those specific responses back. Open-ended, so allows them to give more than just a yes or no response or just the name of the med, So these open-ended are going to give you more. This is where our critical thinking comes in great when we ask these open-ended. And you can play off of the open-ended as well, right? So not only if I'm trying to figure out, a med rec of what happened throughout the day, tell me what happened this morning. Tell me how this all started. You can get a little more specific in these open-ended, but those are going to be really helpful with getting a lot of information out. So being able to recognize the importance, the usefulness, and when to use an open-ended question and a closed-ended question, and also a focus question. So a focus is going to be that definitive information is going to be gained from a focus question. So open-ended is what brings you in here today. Focused is going to be what happened to your knee, right? So what situation is going to be more direct to that knee itself. I don't need the full-on story of it all. I twisted my knee, right? So you're going to get that much more focused, definitive information from that. All right, assertiveness. If it's not something you do now, it is something you will learn, and we will move forward and make sure that you can do effectively and efficiently by the end of your nursing schooling. All right, so it's got a nice little diagram here. So where aggressiveness is your needs, passiveness is going to be other needs, and assertive is a combination of the two. Right, so I'm not just worried about just your needs and just other people's needs, just my needs and other people's needs. I'm worried about both at the same time. So this is where our I messages come into play, right? Not what you say, but how you say it plays a huge role in being assertive. And what I'm overall trying to say is that I count and you count, and how can we get to this common goal, right? It's not accusing, it's not blaming. It is as straightforward as we possibly can get to make sure that both parties are feeling taken care of. All right? So some of these qualities that you're going to see in an assertive person is going to be security. They're secure in themselves, right? When you start to doubt yourself and you start that negative self-talk and you're not giving that positive talk that we need, you're going to start to be more passive and worry about other people. Oftentimes, nursing students can find themselves one or the other, right? Super extreme to the aggressive side or really submissive to the passive side because you're nervous and you're don't want to confront an instructor, confront a nurse. So you will stay more passive and submissive and not really get anything accomplished, right? So being secure in your communication and secure in your stand. Competence, so that you feel are presenting competent in the information that you're presenting, that you have power, you're professional. When you're standing straight up and expressing yourself, maintaining eye contact, speaking in a loud but not shouting in clear voice, and speaking with confidence, fluency, and without hesitation. I think that last sentence really kind of sums it all up, right? So that confidence, fluency, and no hesitation, that you are not doubting, that you understand that what you say is important, and that you want the other person, the receiver that's getting that information, to understand that what you feel is important and you care about how they feel as well. You want a positive outcome out of this. If we speak with assertive tone, assertive communication, we can get through any awkward conversation much more fluently than we would if we use an aggressive tone or a submissive tone. How many times have you had a confrontation and you went either way, right? So if you were submissive and passive, you ended up like you got nothing out of the conversation, right? You went in there, you were like, I'm going to do this, I can do this, I'm going to tell them how I feel. You get through the whole conversation and you just kind of back down and let them talk right all over you, and you got nowhere. You didn't feel any better after you had that conversation, right? Then on the other hand, you were super aggressive. You went in there and you yelled, and you made a stand and you said, you're not going to treat me like this, and blah, 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 and you're wrong, and you this and you that. Did you feel any better after that, right? So then you may feel bad for the other person, but I can tell you the other person definitely felt bad. And you may feel empowered and overwhelmed, but only one person gained out of the conversation. On the other hand, if we use an assertive tone that concerns about both people, that you both matter, we will be successful and both will come out feeling better. So on the path of communication, this SBAR tool is something you'll be very, very familiar with by the end of your nursing career or nursing education career. And this is how we actually will communicate with one another in the healthcare field, how we'll communicate with all providers. And it kind of gives us a framework of making sure we don't miss something, right? So how this works is we're going to talk about the situation that's occurring, any background with our patient, any follow-up assessment, and then our recommendation. Something super simple. Our situation is we have a 12-year-old patient that is presenting with fever. All right, background is they were not feeling good for 2 or 3 days, so they've had a fever for 4 days now. After the initial day, continued on with nausea and vomiting, so on and so forth, right? So that was their background. Assessment, you went in, and this is where you're going to put in all your vital signs. This is where you're going to say that the patient is currently vomiting once every 3 hours, 100 mLs of dark brown emesis. So it's going to be really more specific in that assessment. Your recommendation is we need to do some cultures and see what's going on, and possibly start on antibiotics, right? Or it depends on what your role is. So you as an LPN, your recommendations are going to be less of a direction as in we need to start on this, and more of what you need from the doctor at that moment. All right, and we'll get much, much further into there, but that's how we kind of are communicating through this SBAR tool. Finally, with our special considerations with communication. So we know that there's going to be various alternatives depending on who you're communicating with, right? If you're communicating with a child or you're communicating with an older adult. So an older adult, you're going to want to make sure that you are not talking too fast. That always seems to be one of the big things with speaking too quickly when you've got a lot going on. So slow down your communication. A big thing with older adults, most times when somebody is talking to them, they'll tell you, stop yelling at me, right? Just because somebody's older does not mean that they're hard of hearing. So that's something that we really need to pay attention to. Always with communication, we're going to make sure we're speaking with their proper introductions of what do they want to be called. So somebody with vision impairments, think about things that we need to do to make sure that our communication is being expressed. So if you want to get down to their level, so you want to sit closer to them, make sure that they are aware you're going to introduce yourself, right, who you are, and communicate that way. It depends on, is it a vision impairment or is it complete blindness, right? That's going to kind of impact you a little bit. Hearing. Clearly, you're going to want to speak a little bit louder so that they can hear you better if they have hearing aids. If you are using tools and other things, sign language, and if you don't have sign language and you're going to be using some verbal cues and things like that, then you want to make sure you're in a good positioning for that. Culture and different language barriers. Most facilities, we will have all facilities, a type of translator. So it could be a translator phone. It could be an actual stand-up machine that they have that actually will translate for you. It could be a phone that you talk into, and then the other side, it will translate for you the other way. So There's a lot of different resources for translation. All right, so that is the end of Unit 2. So make sure you're focusing on, again, your outcomes and following through that. And in each situation, when we're talking about communication, assertiveness and things like that, how you would do, not just what do those terms mean, right? How would you present that, and how would you fix situations that are like that? And what could you do as a nurse in such a situation? So aggressive and lateral violence. So we're talking about that aggressive tone, meaning it's more about me and that I matter and you don't matter, right? So only focusing on me. So what is lateral violence? Lateral violence is something that you'll see, hopefully you never see, but you will hear about, and it's a great thing to research so you can get to see some of these experiences and really how dangerous they can be. So this can occur in nursing school, your classmates right next to you, your coworkers. So somebody, instead of somebody in a higher role than you, or a boss to someone below them, or to an instructor to a student, it's laterally, so it's side to side, right? So it's literally the classmate sitting next to you to show that lateral visual, or somebody in your same level, basically. So if you were bullying or talking down to, or talking about a classmate to other students aggressively, all of that is lateral violence and can be really detrimental, clearly to the success of the other student or coworker, but also it's going to start breaking down your ability to move forward. So recognizing when lateral violence is occurring and what you can do to stop it. So, right, if your classmate is talking to you about another student and is really aggressive, and just breaking down that other person, what steps could you do to improve that? What should you say, or what should you do in those situations to be assertive and to stop that?